You probably sat down in your doctor's office or checked your lab results online late at night and you saw something that made you pause. Two numbers, both related to your kidneys. One of them looked high, one of them looked confusing. And then the thought hit you. Does this mean something's wrong? Maybe you've been worried about this for weeks. Maybe you mentioned it to a friend and they said, "Oh, my doctor said my creatinine was high too." Or maybe you're just now starting to realize you. Today, I'm going to show you exactly how these two tests work, why they tell different stories, and most importantly, what your actual numbers are trying to tell you. And by the end, you'll understand something most people never learn, why one test alone would give you an incomplete picture of your kidney health. Let me be direct about this. Kidney disease is one of the most common conditions in adults over 50, but millions of people have it and don't know it, because they're not interpreting their lab results correctly. Not because they're careless, but because the system is genuinely confusing. You see two numbers, neither of them has a label that says, this one tells you about kidney damage, or this one tells you about kidney damage, or this one tells you. They just sit there on your report. Maybe there's a little reference range next to them. Maybe your number is high or low compared to that range, and you're supposed to understand what that means. If you've ever looked at your lab results and thought, okay, so what does this actually mean for my health? Should I be worried? Should I call my doctor? Is this serious? You're not alone. You're not behind. The system just doesn't explain it clearly enough. And here's where this gets important. The difference between understanding these numbers and not understanding them can literally be years of catching kidney problems early versus missing them entirely. People who understand their kidney numbers get tested regularly. They recognize patterns, they spot changes early, and that early detection changes everything. People who don't understand their numbers either panic at a single abnormal result or ignore gradual changes they should be paying attention to. The difference is education. Now, before we dive into the details, let me ask you something. If you looked at your own kidney lab results right now, would you know which number to watch more closely? Would you know if slightly high is different from getting worse? Would you know the difference between a temporary fluctuation and a real warning sign? Most people wouldn't. They think, if my creatinine is high, that means my kidneys are failing. Straightforward, simple, logical, but it's incomplete. And that incompleteness has caused a lot of unnecessary anxiety. Here's why. Creatinine is like a smoke detector in one room of your house. If the smoke detector goes off, you know there's smoke in that room. But it doesn't tell you if there's a small fire nearby that will burn out on its own, or a massive blaze down the hall that needs emergency response. A high creatinine means something is happening. It could mean your kidneys aren't filtering well, but it could also mean you have a lot of muscle mass. It could mean you just ate a large steak or a protein-heavy meal. It could mean you're on a medication that affects how creatinine is processed or eliminated. It could even mean you're stressed or haven't slept well in days. One number alone doesn't give you the full story, and that's why doctors invented eGFR. eGFR, estimated glomerular filtration rate, is like the fire department showing up at your house. It doesn't just look at the smoke detector. It looks at the detector, your house size, the wind direction, whether there are open windows, everything. It takes more information and gives you an actual estimate of what's really happening. So here's the thing, many doctors never fully explain to their patients. And I want to be crystal clear, many doctors never fully explain to their patients. One without the other is like trying to diagnose kidney health with your eyes closed and your hands tied behind your back. If a doctor ordered only creatinine, you'd miss critical context. If a doctor ordered only eGFR, you'd miss the raw data that feeds into the calculation. Both together, that's when you see the real picture. Let's start with creatinine because it's the oldest test and the one most people have heard of. Creatinine is a waste product. Specifically, it's created by your muscles as they use energy. Your muscles are constantly working. When your muscles do work, they use a high-energy molecule called ATP. After the muscle uses that energy, creatinine is left over as a byproduct. Every single day, your body makes creatinine in roughly the same amount, depending on your muscle mass. The more muscle you have, the more creatinine you produce. It's automatic. It's consistent. Here's where the kidney part comes in. Your kidneys filter that creatinine out of your blood, and it ends up in your urine. Then you go to the bathroom, and it leaves your body. There's a balance. But if your kidneys aren't filtering well, if the nephrons, those tiny filtering units, are damaged or not working at full capacity, Creatinine can't be removed as efficiently. It starts to accumulate. It builds up in your blood. When your doctor sees high creatinine, they're essentially seeing this message. Something is preventing these kidneys from filtering waste as effectively as they should be. Now, what is high? For most adults, normal creatinine is between 0.6 and 1.2 milligrams daily, and muscle mass varies enormously from person to person. A large, muscular man, say someone who's 200 pounds and very fit, might have a creatinine of 1.5 or even 1.6. His kidneys could be perfectly healthy. He just makes more creatinine because he has more muscle. A small, elderly woman, say 110 pounds, 80 years old, not very muscular, might have a creatinine of 1.1, and she might actually have significantly reduced kidney function compared to what she used to have. The same number, 1.2 for example, can mean completely different things depending on who you are. This is why laboratories include a reference range on their report. Your range might be slightly different things depending on who you are. But even with that adjustment, creatinine alone is a blunt instrument. It's like saying, the scale says I weigh 150 pounds. That could mean you're a fit person of average height, or an overweight child, or an underweight tall person. The number alone doesn't tell you what's healthy. That's the whole reason eGFR exists. eGFR stands for Estimated Glomerular Filtration Rate. Let me unpack that slowly, because this is the important part. Glomerular filtration rate. It's over an hour, that's 5,400 to 7,200 milliliters. Over a day, that's about 130,000 to 170,000 milliliters. That's roughly 180 liters. That's almost 50 gallons of blood being filtered by your kidneys every single day. Your kidneys filter out all the waste and extra water, which becomes urine, and simultaneously they return the good stuff, proteins, electrolytes, blood cells, nutrients, back to your body. It's an incredibly sophisticated operation happening 24/7. It's not practical for routine screening. Instead, they use your creatinine level plus your age, sex, and race, and they run it through a mathematical formula. The result is an educated guess about your actual kidney function. The formula looks at your creatinine level and essentially says, okay, given this person's estimated muscle mass, based on their age and sex, and given that they're producing this much creatinine, what's their real kidney filtration rate probably doing? Here's what the numbers mean for kidney function. 90 and above, normal kidney function. Your kidneys are filtering well, 60 to 89. Mildly reduced kidney function, still okay, but starting to show some wear. This is where you want to monitor and possibly address risk factors. 45 to 59, mild to moderate reduction. This is stage 3B chronic kidney disease. It needs monitoring and active management. Blood pressure control, blood sugar control if diabetic, medication review. 30 to 44, moderate to severe reduction, stage 4. This requires active medical management. Dialysis or transplant will likely come into play soon. Now, here's what I want you to understand about eGFR, and I'm going to say this clearly. eGFR is not perfect. It's an estimate. Formulas have changed over the years. The older MDRD formula has been updated to newer formulas like the CKD-EPI formula. Some people fall outside what the formula predicts, and their true kidney function might be better or worse than the number suggests. But here's why it's still valuable. It adjusts for that muscle mass problem. It takes the raw creatinine data and contextualizes it for who you are. If you're a 40-year-old bodybuilder with a creatinine of 1.0, your eGFR might be 45, indicating reduced kidney function that needs monitoring. Your eGFR might be 95, indicating normal kidney function. Same looking creatinine, completely different kidney status. This is why doctors need both tests. Not one or the other, both. So here's the practical reason doctors order both of these tests, and I want you to really absorb this because it changes how you interpret your results. Creatinine tells you, here's the raw waste product in the blood. eGFR tells you, here's what that waste product actually means for kidney function, adjusted for who this person is. They work together like two instruments in an orchestra. When your lab results come back and both creatinine and eGFR look good, your kidneys are working well. When your creatinine goes up slightly but your eGFR stays stable, say you were dehydrated the day of the test, your doctor says, okay, let's watch this. It could be dehydration, could be a medication effect, could be normal variation. Let's retest in a few weeks to see if it was temporary. But when your eGFR starts to drop over time, when it goes from 75 to 70 to 65 to 60 over several years, that's when your doctor takes notice. That indicates your kidneys are actually losing function, regardless of where your creatinine sits on the reference range. That declining trend is the real warning sign, and when eGFR drops quickly, say from 90 to 60, that could indicate acute kidney injury, a new medication problem, an infection that needs treatment, or something else that demands immediate attention. This is the distinction that many people misunderstand, and it causes a lot of unnecessary panic. You might see a slightly high creatinine and think, my kidneys are failing, I'm in trouble. But if your eGFR is stable and in a normal range for your age, your doctor might say, let's recheck in a month, but this doesn't alarm me right now. Or you might see a creatinine that looks fine on the reference range, say 1.1, which is normal, but your eGFR is slowly declining year after year, dropping from 85 to 75 to 65. That's the sign that something is gradually changing and needs to be managed. One number alone would miss that. Let me give you some context about what causes these numbers to move, because this understanding will help you avoid unnecessary worry. For creatinine, here's what can make it go up without your kidneys being damaged. Dehydration. When you're dehydrated, your blood is more concentrated. Everything in your blood becomes more concentrated, including creatinine. The number goes up. You drink water, rehydrate, and it comes back down. This is temporary and reversible. High muscle mass. More muscle means more creatinine production. This is normal. Certain medications, ACE inhibitors, NSAIDs like ibuprofen, some blood pressure medications, these can sometimes affect creatinine levels temporarily or change how the kidneys handle it. A diet very high in red meat. The cooking process in meat creates compounds that can influence creatinine readings. It's usually temporary, a recent infection or significant stress. Short-term elevations happen during acute illness. Heavy exercise, intense workouts can temporarily increase creatinine. For eGFR, the causes of decline are more specific to actual kidney function problems. Diabetes. High blood sugar damages the filtering structures over years. This is the leading cause of kidney disease in the United States. High blood pressure. It damages the tiny blood vessels in the kidneys, reducing their ability to filter. Chronic kidney disease itself. Progressive damage to nephrons, recurrent kidney infections or pyelonephritis, certain medications used long-term, NSAIDs if used regularly, some blood pressure medications if used improperly, certain antibiotics, autoimmune conditions that attack the kidneys, polycystic kidney disease or other inherited kidney conditions. The point is, when you see a number, context matters enormously. A creatinine that goes up and then comes back down with better hydration is not the same as an eGFR that's steadily declining over a year. They tell different stories. So here's the practical answer to the question you came here to ask. When should you actually be concerned about these numbers? First, one abnormal result is usually not cause for immediate panic. If your eGFR drops suddenly or your creatinine spikes with no obvious cause, your doctor will retest. Sometimes it's a lab error, sometimes it's temporary dehydration or medication effect. Sometimes it's just normal variation in the test. Good doctors don't diagnose from a single result. They look for confirmation. A declining trend, especially a rapid decline, is when you need investigation and possibly treatment adjustments. Third, look at both numbers together. If your eGFR is 55 but your creatinine is completely normal for your age, ask your doctor if there are alternative explanations. If both are declining together over time, that's a clearer sign of actual kidney function loss. Fourth, if your eGFR falls below 60, that's a milestone. Anything 60 and below is considered stage 3 or worse chronic kidney disease. Fifth, rapid change is urgent. If you see a sudden drop of 15 or 20 points in your eGFR in a short time, that requires immediate attention. That could indicate acute kidney injury, a new medication problem, an infection that needs treatment, or something else that demands investigation. Here's what I want you to do with this information. First, get a copy of all your lab results, not just the current ones. Get the last few years if you can. Look at the trend yourself. Is your eGFR stable? Is it slowly declining? Is it dropping fast? Your doctor knows your full medical history, your diabetes status, your blood pressure history, your medications, your age, your race, your body composition. They know whether you're a particularly muscular person or someone with little muscle mass. Your eGFR number might look low on paper but be normal for you personally. Or it might look fine but represent a significant change for you. Third, if your eGFR is in the four things, these are the levers most people can control. Blood pressure management. If you have diabetes, are we controlling it well? Medication review. Is anything I'm taking stressing my kidneys? Hydration. Am I drinking enough water? Fourth, if you're over 50 or you have risk factors like diabetes, high blood pressure, or a family history of kidney disease, get these tests checked at least once a year. Regular monitoring catches problems early. Early detection gives you time to act. That's the whole game. So if you remember only one thing from this video, remember this. eGFR and creatinine are not competing tests. They're teammates. They work together. The most important question is not, is this number high? The most important question